Hi, I'm Dr. Christine Rankin with South Metro Wellness Clinic. Welcome back to our YouTube channel. Today we're going to be talking about several things that chiropractors treat very well, very regularly, but the public doesn't necessarily know about. Winter is in full swing. There is ice on the roads, there's snow on our rooftops, and there's plenty of slipping and falling to go around. In the last week, we've had 3 new patients come in with slip and fall injuries and several things that we treated aside from their main complaint that they would not have expected on first glance. So today we're going to go ahead and review what those specific things are. When you are walking along an icy sidewalk or you're getting out of your car, that has been the most popular thing that has happened, or you're just kind of tired or groggy from a cold or a flu and you're just walking along. You might not necessarily have your guard up where it normally is and you hit an ice patch or some wet spot on the floor and you slip. Your knees and your legs buckle and come out from under you, and then you slip and fall on your tail. Okay, you're going to have one heck of a case of low back or sacroiliac joint pain. So we're going to go ahead and review where exactly that is. If you have a slip and a fall in that proportion, you're going to have an issue right in here and right in here. And you also could possibly potentially have bumps and bruises on your rear end, as well as swelling and joint pain right here where the sacrum and the iliac bones come together. These are actually very relatively easy fixes. People will go ahead and ice, rest, elevate, all the regular things. And when the swelling comes down, they may be left with some stiffness, and that will eventually subside. What people have not stopped and thought about, however, is what happens when people brace themselves before the fall. So very, very popularly here this last week, we had several people get out of a car and it just perhaps parked and didn't see exactly how much snow and ice was there. Plus 2, when you have snow on top of ice, it doesn't do us any favors. We've all been there, right? So we get out, we slip and fall, and then just as the fall is happening, you all know what I'm going to say, we brace ourselves or try to catch ourselves to either protect our main body with the extremities. So chiropractors adjust any joint that moves, any joint with a joint space, a joint capsule, or cartilage. Anything that will move, that's called a mobile joint, we can adjust out. So most people actually get really surprised when you're like, oh, you can adjust that? Yes, absolutely. I can adjust a finger, a toe, a knee, your wrist. There are 8 bones in your wrist. They all move before your forearm, your elbow. Anything can be adjusted. So we had several specific cases where we had a serious shoulder compression injury. Also, it's very, very common for people when they're driving their vehicle, if they are rear-ended or sideswiped, they have whatever arm it is that they're driving with, correct, completely out on the steering wheel. And when the impact happens, they end up with not just a seatbelt injury, but a compression injury in there as well, where the actual shoulder girdle gets really aggravated and irritated, and it takes some time for us to go in there and treat and unwind that injury by doing some distraction, pulling everything out. It's very effective. It's certainly a heck of a lot better than walking around with pain and waiting for it to go away by itself, which is a very common thing that human beings do. We always want to tell ourselves it'll get better by itself. Sometimes yes, but sometimes no. So it's extremely important that if you have had a slip and a fall, or if you know somebody who's had a slip and a fall, and they're anywhere in the South Metro area, I'd be happy to treat them. We go in and we clean up any kind of extremity adjustment right along with the spinal adjustment. It's all included in the visit. It's just very, very quick. It's very simple, and it typically saves people a lot of pain and aggravation. So with that note, I also wanted to give you guys a couple heads up here with our upcoming videos. Some of us were under the weather on our team here in the last couple weeks, so we were unable to film and actually get all of our videos processed. For our Latin community, we were going ahead and taping some adjustments, taking some pictures. Some of that stuff is going to be going on our Facebook page, South Metro Wellness Clinic, PLLC, P as in Paul. That's going to be going up here shortly once all of our videos are processed. And as well, we're going to be talking about how we do these adjustments and other not as common things that chiropractors treat, colds, flu, torticollis, and things that kids have, because it is full swing winter. Colds, flu bugs, all kinds of fatigue, all kinds of burnout, adrenal fatigue, things that we're seeing people go through now that the holidays have since passed. A lot of stress responses are coming up to the surface. So with that, those are our previews for next week. I will be right here again filming on Tuesday with my fabulous videographer, Jerry. Thank you, Jerry, for everything that you do for me. We will see you guys next week, and thank you so much for joining us. Until then, be careful, watch the snow, watch the ice, don't slip and fall. Thank you.